Doctors of Reddit, what is the biggest mistake you've made? Serious. Not a big mistake but definitely awkward at the time. I was gluing up a lac on a 14-year girl's forehead. Anyone who has used Dermabond before knows that stuff can be runny and bonds very quickly. I glued my glove to her face. Her mum was in the room, and I had to turn to her and say, "I'm sorry, I've just glued my glove to her face." Pathologist here. Biggest mistake I ever made was cutting myself during an autopsy on an HIV patient. Lucky for me, I did not acquire the virus, so everything had a happy ending. For me, anyway. That guy was still dead. I missed a gunshot wound once. A guy was dumped off at the covered in blood after a rap concert. We were all focused on a gunshot wound with an arterial bleed that was distracting. The nurse placed the blood pressure cuff over the gunshot wound on the arm. We all missed it because the blood pressure cuff slowed the bleeding. I was doing the secondary assessment when we rolled the patient, and I still missed it. We didn't find it till the chest x-ray. The bullet came off rest in the posterior portion of the thoracic wall without significant trauma to major organs. The patient lived, but I still feel like I fricked up big time. I was working in the OR when a guy came in for a scratch on his neck and feeling drowsy. We start the usual workups and this dude's blood pressure tanked. We scrambled, but he was dead within 10 minutes of walking through the door. Turns out the scratch was an exit wound of a .22 caliber rifle round. The guy didn't even know he'd been shot. When the coroner's report came back, we found that he'd been shot in the leg and the bullet tracked through his torso, shredding everything in between. There was really nothing we could have done, but that was a serious what the frick just happened moment. This thread is pretty depressing, so I'll lighten it up a bit. A few months ago, I accidentally ran a creatinine test on a patient when a comp metabolic wasn't ordered. It turns out that the guy was in renal failure, and no one knew. He was about to go in for surgery. I believe it was a bypass, but could be wrong. But I got the results in time to stop them from putting him under. Crap could have been messy. I'm glad I screwed up, and I'm sure he has no idea that he could have died. My brother is a surgeon, and during part of his residency, he had to work in the pediatric unit. He was working with 2 newborns. One was getting much better and fighting for life. He was going to make it just fine. The other baby was hours from death. He wasn't going to make it. My brother was in charge of informing the families. My brother realized about 15 minutes later that he had mixed up the families. He told the family with the healthy baby that their baby wasn't going to make it, and he told the family with the dying baby that their baby was going to be just fine. He then had to go back out to the families and explain the situation to them. How devastating. To be given a glimmer of hope and have it ripped away from you not even an hour later. That was most upset I've heard my brother. He felt destroyed. As a very young doctor in training, I misdiagnosed a woman with epilepsy. Some years prior she had sustained a gunshot wound to the frontal area, damaging the underside of one of her frontal lobes and severing an optic nerve to one of her eyes, as well as some of the muscles that rotated that eyeball. Surgery saved her life, but the frontal lobe was scarred and the eye was blinded and always pointed down and at an angle away from her nose. A few years after that she began having spells of a bizarre sensation, altered awareness, a pounding in the chest, and she had to sit down, stop what she was doing, and couldn't speak. These were odd spells and I assumed she had developed frontal lobe epilepsy from the scar on her brain. Increasing doses of anti-seizure drugs seemed to work initially, but then the spells came back. A couple years after my diagnosis, her endocrinologist, who treated her for diabetes mellitus, checked her thyroid. It was super high. The spells were manifestations of hyperthyroidism. She drank the radioactive iodine cocktail which ablated her thyroid, got on thyroid replacement therapy, and felt well thereafter. No permanent harm done and she was able to come off the anti-epilepsy drugs. She was obese, not the typical skinny hyperthyroid patient, and if she developed thyroid eye disease, I couldn't tell because her one eye was already so messed up. I see how I screwed it up. But in retrospect I have never been sure what I could have done differently, except test her thyroid at the outset of treatment. Hence, a lot of patients, thousands, have had their thyroid checked by me since then. Every so often I pick up an abnormality and it gets treated. The lady was an employee of the hospital where I trained and I ran into her one day. She gave me a hug and let me know how this had all gone down. She made a point of wanting me to know she didn't blame me because I always seemed to care about her and what happened to her. I think about her and how I screwed up her diagnosis and set back her care almost every day. I am a much better diagnostician now, but I always remember this case and it reminds me not to get cocky or be too sure that my working diagnosis is correct. My mom just retired as an OBGYN and she told me about a time early on in her career when, while not a real medical mistake, she still almost ruined the operation. She was performing a C-section, I think, and she dropped her scalpel on the floor. Before she could think, she blurted out "oh crap" as a reaction. The mother, thinking something was wrong with the baby, started panicking. It took a team of nurses, the husband, and the mother of the patient to calm her down. Farmed here. Couple different quick stories. Heard of a pharmacist who filled a fentanyl patch incorrectly and the dose was so high that the patient went into severe respiratory depression and died. They're still practicing. Worked with another pharmacist back in the mid-2000s when I was still a tech who filled a script for Prozac solution. Concentrated it is 20 mg per ml. Average adult dose is 20 mg. Instead of 1 ml once daily he filled it for 1 teaspoonful. 5 ml. The child got serotonin syndrome and almost died. He is no longer working to my knowledge. My husband nearly died of a fentanyl overdose after a rookie EMT was allowed to administer it via injection. She gave him 4 times the safe dosage. That's some serious crap. My grandmother has had diabetes for about 20 years and takes a handful of meds to help control it. About 10 years ago, she developed a persistent cough. It wasn't bad. She said it felt like a constant tickle in the back of her throat. She went to her doctor to find out what was going on, and he ordered a battery of tests concerned that she was developing pneumonia, lung cancer, etc. All the tests came back negative, so he prescribed a cocktail of pills to help combat it. Over the span of 5 years, she had tried about 35 different meds and none helped. One day when she went in for a routine checkup, her normal doc was out and she saw one of the on-call residents. He looked at the barrage of pills she was on and asked why. When she explained, he replied, "Oh, the cough is a side effect of this one particular drug you're on to regulate your insulin. If we change you to this other one, it will go away." I have noticed that when I see a new doctor because mine is on vacation, I often get new and important information. My parents are nurses. They knew a doc who'd been on a 36-hour shift. Patient came in with a punctured lung, I think, and the doc had to collapse the lung to fix whatever was wrong with it. Through tiredness he collapsed the wrong lung, and the patient died. Doc ended up killing himself after being fired. Don't burn yourself out. Someone else tragically lost their life years ago, but the incident saved my sister's life about 10 years later. Several years ago, my sister and I were in a car accident. I had visible injuries. She did not and was walking around without any problems. So we thought. 9 days later, she was preparing dinner, began to feel ill, vomited and then passed out. She was taken by ambulance to the hospital emergency, and after talking to my brother-in-law for only a couple of minutes, he rushed my sister into surgery and removed her spleen immediately. It had ruptured in the accident but was a slow bleed. My sister was in ICU for a couple of weeks but survived and is in good health today. Later, the admitting trauma surgeon said he recognized what was happening because of a mistake his college professor told the class she made as a surgeon years earlier. A teenage boy had fallen from a cliff and hit rocks below. Other than being bruised, he was fine, so did not seek medical help. 7 days later he was brought unconscious into where the college professor was working as a surgeon at the time. She and her team were not able to quickly identify his symptoms of a ruptured spleen that had happened 7 days ago. The teenage boy died about an hour later. She was always sure to share this particular incident with her students, thus saving my sister's life when one of her former students, my sister's doctor, showed up to class that day. As an ICU nurse, I've seen the decisions of some doctors result in death. Families oftentimes don't know, but it happens more than you think. It usually happens on very sick patients that ultimately would have died within 6 months or so anyway. Though, procedural wise, I have seen a physician kill a patient by puncturing their heart while placing a pleural chest tube. It was basically a freak thing, as apparently the patient had recently had cardiothoracic surgery and the heart adhered within the cavity at an odd position. I'll never forget the look on his face when he came to the realization of what had happened. You rarely see people accidentally kill someone in such a direct way. Heartbreaking. I'm a nurse. I've given an anticoagulant, blood thinner, to the wrong patient. Over the next day his red blood count dropped. He ended up in ICU. My first day as a camp nurse for people with intellectual disabilities, I gave 9 pills to the wrong guest. I didn't know who I was looking for and asked my friend to send out the guest. His hypochondriac roommate walks out, tells me he is the person I'm looking for. I asked my friend for confirmation, who thought the correct person had come to me and confirmed from afar that it was, and I administered the meds. He had a lot of drug allergies. Stomach dropped when the actual person I was looking for came out 12 seconds later. Luckily, we called poison control and most of the pills were vitamins, and the ones that weren't were either similar to ones the guy was already taking, or in therapeutic low dose form. He was fine and still continued to ask for everyone else's pills at all times. Worked there 2 summers and thankfully had no other disasters like this one. Hey, at least your mistake was a valid one. He claimed he was the kid you were looking for. I had a short stay at a psych facility, a home-style place, and they attempted to give me someone else's drugs, very different DX entirely, and tried to shush me when I balked at first. I've posted this before, but I'll copy it here. I had a 9-year-old girl brought in one night with her parents complaining of fever and respiratory distress, presenting with coughing and wheezing. The kid was really out of it and the parents were very upset. I thought it was bronchitis, but I admitted her and ordered treatment for her fever and cough as well as throat cultures. I was with another patient when the kid started hallucinating, sobbing and spewing everywhere. I figured it had to do with the fever, so I packed her with ice, but she died maybe a half hour after that. This wasn't my first death, but it was one of the worst. I couldn't tell the stiff neck since the kid was out of it. She also couldn't tell me anything else that would point to simple or complex seizures. She died of Neisseria meningitis. Completely wrong diagnosis. To make matters worse, we called in all her schoolmates and anyone else we could wake up just in time to see 3 other kids go. The rest got antibiotics quickly enough. Probably my worst day in medicine. Had to look that disease up. Holy crap. You have been visited by the happy husky. Within the next 24 hours you will experience happiness. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video, or don't. Either way, have a great day you magnificent people.